The suprasternal window is a fairly small window, so there's not much variation with respect to where you can put the transducer. But still, you need some practice at least to find the heart and to get the information that you need. So this is the suprasternal view. We're imaging the heart from the top, imaging downwards. You should orient the transducer in such a way that you transect the aortic arch in a longitudinal fashion and thereby get a long axis view of these structures. The first structure you will see is the aortic arch. This is the way the view looks. You have the aortic arch here with the ascending part and the descending part. The vessels which leave the aorta are visible, and the right pulmonary artery which undercrosses the aortic arch is also seen. This is an example of a patient imaged from a suprasternal approach. However, this is not a normal patient, but this patient has coarctation. This is the ascending part of the aortic arch, and there we're seeing the descending part, which is more narrow and which shows obstruction further down, and the right pulmonary artery is seen here. This view can be used to look at dissection and the dimensions of the aorta, especially of the aortic root. And probably the most important application is that of looking at regurgitant flow in patients who have aortic regurgitation. In addition, as you can see in this image, we can also look at coarctation and even quantify the degree of coarctation. The last view that I would like to show you is the right peristernal window, which does have certain applications. We can use it for 2D imaging, but especially also for Doppler imaging. The location of the right peristernal window is on the other side of the sternum, not the left, but the right window. And again, you can use either the second, third, or fourth intercostal space to look at the heart. This shows you the probably most important application of the right peristernal window. It's to assess aortic stenosis severity with the help of continuous wave Doppler. This is such a spectrum which we acquired from the right peristernal approach. We'll talk more about the importance and how to perform this view in the chapter on aortic stenosis, but we'll take a quick preview in the next demonstration. To image from a right peristernal approach, we need a so-called pencil probe. The pencil probe has the advantage that the surface is small and it's quite easy to go right in between the intercostal space. However, we do not have a 2D image. To image the patient, we have to put him in a position where he turns to the right as far as possible. We also tell the patient to raise his hands above his head. And then we place the transducer in the right intercostal space and direct the pencil probe towards the left, so towards the heart. This transducer position is ideal to quantify patients with aortic stenosis, and this is a patient with aortic stenosis, so we can see that the patient has a signal which moves towards the transducer. It's above the zero line. So this must be the signal of aortic stenosis. You can also appreciate we do not have a 2D image, only the Doppler spectrum. It's important to use very small adjustments of the transducer to optimize your signal and to really put the patient in a position where he's turned to the right as far as possible. So this concludes the different windows that we have available for echocardiography. And I think you saw that the heart can be imaged from many positions, and that you will learn which position is most appropriate for the specific question that you want to answer. But keep in mind that you should always try to image the patient first from a peristernal approach, and then proceed to an apical approach, then the subcostal approach, and if you have certain questions, also perform a suprasternal and a right peristernal echo window examination.